Breastfeeding and thrush. Thrush infections can sometimes happen when your nipples become cracked or damaged. This means the Candida fungus that causes thrush can get into your nipple or breast. If you suspect you or your baby has a thrush infection, see your health advisor or a doctor. The two main signs of thrush to the mother includes starting to feel pain in both nipples or breasts after feeds, especially if you previously had no pain after feeding. Quite severe pain that lasts for up to an hour after every feed. Signs of oral thrush in breastfed babies include creamy white spots or patches on the tongue, gums, roof of the mouth or insides of the cheeks. If you gently wipe these patches with a clean cloth, they won't come off. Your baby being unsettled when feeding. A white film on the lips. In some babies, nappy rash that won't clear up. Treatment of thrush during breastfeeding. A visit to a doctor can help in arranging for swabs to be taken from your nipples and your baby's mouth to see if thrush is present. Treatment can also be done by a cream containing clotrimazole and a single oral dose of fluconazole. In most cases, some women may need to take antifungal tablets to clear the fungal infection. Breast engorgement. It's when your breasts get too full of milk. They may feel hard, tight and painful. It can happen in the early days when you and your baby are still getting used to breastfeeding. It can also happen when your baby is older and not feeding so frequently, perhaps when they start having solid foods. It can be managed through expressing excess breast milk by hand or breast pump. Baby is not latching on properly. Breastfeeding is a skill that you and your baby need to learn together. It may take you both a while to get the hang of it. If you are finding breastfeeding painful or your baby does not seem to be satisfied after feeds, they may not be latching onto the breast properly. Latching process. Hold your baby's whole body close with their nose level with your nipple. Let your baby's head tip back a little so that their top lip can brush against your nipple. This should help your baby to make a wide open mouth. When your baby's mouth opens wide, their chin should be able to touch your breast first, with their head tipped back so that their tongue can reach as much breast as possible. With your baby's chin firmly touching your breast and their nose clear, their mouth should be wide open. You should see much more of the darker nipple skin above your baby's top lip than below their bottom lip. Your baby's cheeks will look full and rounded as they feed. Sore or cracked nipples. Sore nipples usually happens because your baby is not well positioned and attached at the breast. Putting up with it could make pain or discomfort worse, so it's important to get help from a nutritionist or breastfeeding specialist as soon as you can. Self-help tips for sore nipples. Wear a cotton bra so air can circulate. Avoid using nipple shields, which is a thin protective cover worn over your nipple as you breastfeed. Warmth can help the milk flow, so a warm flannel, or a warm bath or shower, can help. Get as much rest as you can. Go to bed if you can. Take paracetamol or ibuprofen to relieve the pain. Mastitis. It's an inflammation of the breast which happens when a blocked milk duct is not relieved. It makes the breast feel hot and painful, and can make you feel very unwell with flu-like symptoms. It's important to carry on breastfeeding. Starting feeds with the tender breast may help. Common symptoms of mastitis. Breast that feels hot and tender. Red patch of skin that's painful to touch. General feeling of illness, as if you have flu. Feeling achy, tired and tearful. High temperature or fever. Self-help tips for mastitis. Check your baby's positioning and attachment with the help of a midwife, nutritionist or a breastfeeding specialist. Carry on breastfeeding. Let your baby feed on the tender breast first. If the affected breast still feels full after a feed, or your baby can't feed for some reason, express your milk by hand. If you want to know the several techniques of positioning, give this video a thumbs up and leave a comment down below, so that I can do another video on positioning techniques that you can learn to breastfeed your baby. Blocked milk duct. It may come about due to continued breast engorgement. It's associated with a feeling of small tender lump in your breast. Frequent feeding from the affected breast may help. If possible, position your baby with their chin pointing towards the lump so they can feed from that part of the breast. You can manage this by frequent feeding from the affected breast. Warm flannels or a warm shower to encourage the flow. Gently massaging the lump towards your nipple while your baby feeds. Avoid wearing tight clothes or bras so your milk can flow freely from every part of your breast. Thanks for watching this video. I've invested much of my time and energy making this video. Please like this video, give comments and subscribe to my channel. Please subscribe. Frank with Home Nutri-care signing out.